Hello, hello. JVix here. Welcome to another episode of Meet the Experts. Meet the Experts is a video platform where we talk to small business owners and otherwise cool, interesting people who are doing really neat things in their fields, just to give them a chance to get on video and get some more video content made about their business. Think about it as like an About Us or an FAQ section on a website, but using video. And a lot of people don't really know how to do that, or they don't have time, or they just like to use appearances that they make on other people's shows. And podcasting is a good way to do that these days. So if you stick around till the end of the episode, I will tell you how to become a guest on Meet the Experts. Costs you nothing. And so stick around to the end of the show. It's been a crazy day, and I'm so excited to kind of wind it down a little bit with somebody I recently met. We did a sound check, met virtually anyway. We did a sound check to make sure everything was going to be good. And it was. And I'm really excited for today's guest, Monica. She is now, I have to look over here where I have it written down because it's a kind of a long director of nursing practice, acute care nurse practitioner. Okay. But I read her bio, and it's like, I was like, wow, if I read that, may as well not have you on the show. It's really good. You've got so much stuff that you've done. So I hope we get to cover a lot of that on today's show. But without further ado, let me bring Monica up. Monica, hi, how are you?
Hey, how are you?
I'm doing well. Thanks for coming on.
It's a pleasure. Let me just clarify. The D actually stands for doctor. So it's a doctor of nursing practice.
Did I not say doctor?
I think you said director, maybe.
Did I really? I might have. Yes, doctor of nursing practice.
I direct a lot of stuff too, but
it's been a day. Let me just tell you. I was just telling you a few minutes ago. It was just Zoom, Zoom after Zoom after Zoom, and I'm glad we're finally getting to do this recording.
Yeah, definitely.
Well, cool. Well, all right. So that's kind of a good a long title. So why don't you tell us more about you and what you do?
I am a doctor of nursing practice. I am acute care nurse practitioner, board certified. I see adult critical care patients. In the past, I've done cardiology as a nurse and then a nurse practitioner going on about 25 years now. So I do everything critical care, meaning in the hospital. Either if you come to the hospital and have to be admitted, they call me down to come to admit you from the ER to the hospital as a hospitalist, or inpatient cardiology critical care. But I also see cardiology patients at our local free clinic here in Pensacola, Florida.
Very cool. Okay, so you're down in Florida. So typically I ask like products and services and who they help, but I think you kind of just answered that. But I did notice one thing, and I don't think we talked about this. I did notice something. Were you appointed to something by the governor?
I was. I'm still on. I was appointed by Governor Ron DeSantis on the Pediatric Cardiology Technical Advisory Panel for the state. So I am the only non-voting member because I'm the only nurse practitioner. All the other ones on the panel are cardiovascular surgeons or cardiologists. But that is the only thing I'm involved in that has to do with pediatrics, because in my board certification is all about adults. I only take care of adults, but I do anything. I'm involved in congenital heart disease things for pediatric to adult care.
Wow. Okay.
Meaning if they were born with living into adulthood now for congenital heart patients, if they were born with something, wrong with their heart, then had to be repaired or fixed or go to surgery, then, living into adulthood now is the norm, not the exception. So they're, thankfully for all these pediatric surgeons and cardiologists taking such good care of them, they're living a lot longer.
I noticed that one of the things I listen to New York Sports Talk Radio. I grew up in New Jersey. I've talked about it a bunch, but one of the shows that I listen to on the radio is a show that Boomer Esiason is on. And he, of course, has a son with cystic fibrosis who has now grown up into adulthood. And he said the same exact thing. He's like, what used to be like the exception to make it to be an adult is now becoming the norm because of awareness, because of money, because of boards that and people that take care of people. So I get it. I think that's awesome.
And that is part of what I do is advocacy. I go to legislators, either statewide or U.S. Congress, and ask for appropriations for research, funding, research, things like that, to go to NIH for congenital heart research.
That's awesome. So I need to ask you this. One of the biggest things now, I'm in marketing, right? And in marketing, the rage is AI. Everybody's talking about AI, right? AI, virtual reality. I have a headset, like I love it, except my child always wants to play with it and it's too big for her head. So, but AI and VR are definitely hot topics. Now, what do you see as the trends or the future of that? Like, how is that going to impact patient care? Give us a glimpse.
Wow. Great question. Definitely very current, but definitely AI, the virtual reality, 3D printing. It is already making huge impacts in healthcare. It does come with a lot of responsibility for us to be good stewards of that AI, make sure patient safety and security, things like that, are still taken care of. But I mean, this makes a difference. All the innovation and technology that has come around, especially since telehealth, COVID came and then telehealth boomed. And now there's legislation out there to increase the telehealth with broadband, taking it to communities and areas that didn't have cable before, didn't have phones or even access to telehealth. So it increases not just access to care to certain communities, but it makes our work increasing efficiency. So even from the scheduling standpoint, scheduling of kind of nursing staff, provider staff, the physicians, nurse practitioners, any kind of scheduling, even scheduling patients, the follow-up and callback, some of that is done now through AI, the automatic phone calls to the patients and getting their scheduling or seeing how they're doing post-op or post-procedure, things like that. So it's helping with our charting. In the hospital itself, it is helping with some admission care and some discharge care and just even virtual rounding with some physicians and expert consults, anything like that is just makes it easier, more efficient, increasing provider engagement, increasing patient engagement. So it's a lot. I mean, like I said, it is even the 3D. We can take, like I said, the baby hearts that I do some things with is if you can 3D print someone's heart and then pre-procedural plan before you even go in the OR, we're looking at a 3D model to show the patients, this is your heart now, this is what we're going to do, this is how we're going to fix it type thing. And so it's used for education for patients and families, used for pre-procedural planning, things of that effect. But the post-op side of it is, or the post-procedural, the innovation and technology is making it such that a lot of the procedures that were done that required long stays are being done outpatient. So they're either done outpatient or same-day surgeries, ambulatory care centers, or they're being discharged the next day. So it's really helping make everything more efficient and safer for the patients. And the recovery time, the follow-up time is a lot easier.
Yeah, it sounds like it. I mean, you think about it and you're like, oh, AI, VR, it's nice technology. Yeah. It's a good hobby to look into and start to learn. And then it's like, no, like it's not the future anymore. This is the current. It's here. And this is what people are using. I love.
Yeah. And I hate to still say cardiology, but that's what I do. But even orthopedics, they're like 3D printing joints now to put in knees and things, so it's amazing what they can do with all the new technology and the advancements.
I'm so glad we have this technology. It's just from healthcare. It's wild. All right. So obviously, I would never ask you for like a patient that said something nice and ask for a name. I know there's privacy laws. I wouldn't want anybody telling somebody something I said and using my name, but well, maybe I would. But Do you have any, maybe I should phrase it this way, with regard to your professional life, do you have any wins or testimonies, like something somebody said that you still think about, just like major day, and it sticks with you for a long time, about how well you do at your job?
I have a lot of them because my cardiology is such a, it very either urgent or emergent, some of the things I do. But one definitely, we have patients that come in, and overall, just being able to educate patients, outreach patients, and help them have a better quality of life and a better, even generational. So they've never been seen by a nurse practitioner or cardiologist or their physician, and they don't know what a good cholesterol is or a good blood pressure is, things like that. So just being able to educate them to where they live a better life, better improve their outcomes. And I've had patients come in that I know that, especially on the congenital side, if they come and see us, then I have to get them straight to a congenital surgeon, and things like that. So the specialty interaction, the specialty consults, that's even in cardiology, for me to know, I see the patient when they're critical, and instantly I need to know who I'm going to send them to, either an electrical doctor or somebody that can put a stent in, or what's called an interventionalist, or structural, fix their valves, things like that. So it runs the whole gamut, but mainly I love it. And I have to say, literally just last week, me and a physician that also sees patients at the free clinic, and the director of the free clinic just won $100,000 grant from Amgen Pharmaceuticals for cardiovascular outreach in historically Black communities around Northwest Florida. So that, they've historically been experiencing healthcare disparities and healthcare inequities. So this grant is going to allow us to outreach to those communities and go educate. And so to me, that is why I do what I do. So I can, if I can make a whole community, educate them on their cardiovascular health and keep them healthy, that's what it's all about.
That's a huge win. And it's such a great thing to do. Like, congratulations. That's incredible. So
as we say in medicine, American Heart Association, American College of Cardiology, we look at different disparities and inequities, things like that. But sometimes, zip codes, the old saying, zip codes are more important than your genetic code sometimes. So we need to outreach to different zip codes. And this is going to allow us to do that. So it is huge. Thank you.
That is awesome. No, it's great. All right. So getting to this stage, getting abbreviated letters after your name takes a lot of work, right? And it's a lot of hard work, and it takes a lot of education and trainings and everything else. So talk about, how did you earn it? We call it the earn it, learn it, improve your authority. How did we earn it, learn it, and prove your authority? What was your educational history like?
Right. Well, I kind of went into this, thrusted into cardiology because my son, he's 33 now, doing great. But he was born with a congenital heart defect and he needed heart surgery. But I was doing business back then. I did marketing and business and things. I had my business degree first. And so then I went back to school. I got my bachelor's in nursing at Johns Hopkins. And I went to nursing so I could learn how to take care of him. So it is, then I just fell in love with cardiology, of course. And so since then, and that was back in 1996. And so then I went to get my master's in adult acute care to learn how to take care of adult hearts at Georgetown University. And that's where I got my acute care NP. And then on to Vanderbilt for my doctorate. So those are my kind of steps that I have taken. But I have also went just total all in with cardiology. The past few years, I sat on the American College of Cardiology board for the state of Florida.
Wow.
And I sat on the Critical Care Cardiology Leadership Council for National ACC. And I'm still sitting on board. I have a meeting at the Heart House, what we call our Heart House for cardiology, in DC in a couple of weeks. So still very, very active. And I still sit on the pediatric panel.
So what you're saying is you're kind of okay.
I try to do, well, a lot of stuff is I do for legislative affairs, health policy stuff. And that's where I think now the trend for nurse practitioners, doctorates, nurse practitioners, we are becoming more, we're having a seat at the table if there is a health policy, a public policy, any kind of legislative things that, we're becoming more vocal, more advocate. We want to sit there, and a nurse practitioner needs to be at that table if there's something that is going on in healthcare or providers or patients, that affects them. We need to have a voice in it. We're kind of disrupting the delivery of care, increasing the access to care. And so we need to, have a seat at that table. And I think we are. The whole leadership now trend is we're a lot more involved, and we're making, those impacts. Because we know when we go into health policy, you need to know, who it's going to impact, how it's going to impact them, why you're even doing what you're doing. And then what is your ask for legislator? What is your ask for Congress, that type of thing? And mine, of course, is all about kind of funding appropriations. And Governor DeSantis just put in I went, representing American Heart Association to talk to senators, and they put it in our budget for Florida, and we got money appropriated for heart education through the Florida budget. So those things like that, they matter. The voices matter and presence matters. So I think that's what nurse practitioners are doing, increasing their presence.
Yeah, you definitely need a seat at the table. I mean, you're very front line. You're
definitely.
And and I know I kind of didn't really allude to this earlier, but what is is there a shortage? What's the job market like right now for nurse practitioners?
There's a workforce demand, definitely. I would like to put it that way. There's always, I just actually read an article this morning on, I don't know if you follow Becker's Healthcare Review, but they just came out that, and I think that it was a 2023 report that the acuity level in the hospital is going up, the complexities are going up to take care of the patients. So of course, my acute care nurse practitioner certification is very much needed. So my thing is, I want nurse practitioners to be aligned with what patient population they're serving. So I want nurse practitioners. So I would love, a lot more to go into acute care, to be able to take care of not just the patients in the hospital with high acuity now, but we're discharging them higher acuity back to home, where we're monitoring them at home. And that takes a specialized nurse practitioner, things like that. So there's a workforce demand in nursing and nurse practitioner for us to be, very specialized in whatever area we want to practice in, whether it's OBGYN or orthopedics, neuro, mine's cardiology. But there are definitely challenges in, holding on to nurses, holding on to good nurses. So that is, countrywide. But of course, the American Association, the ANA, things like the nursing associations are definitely working on all those challenges and getting the workforce. There, even, I hate to keep coming back to Florida, but that's where I live. Oh, yeah. Governor DeSantis, just wrote, and actually it was in the CARES Act, millions of dollars funding for nursing education.
Wow. Okay. So, no, that's incredible. All right. So we're kind of starting to wind it down, and this has been really, really fascinating. Like, my mind is spinning with all the stuff that's going on.
I know. Sorry, I could talk about this all day.
I'm sure. Well, that was kind of one of the things I wanted to allude to. I think I find it so awesome that you kind of ultimately got into this because of a son, a family member who needed help, and then it kind of inspired you to get into that and triggered you to do that. So
it's definitely my drive and why I do what I do, and my passion behind it. So that helps a lot.
Well, and now you also have, which I have the ticker at the bottom, you have a podcast, the Monica Sanford Show, right? You want to take a minute and talk about that for a second?
I do. It's called the Monica Sanford Show. Thank you so much. I talk to whoever I want to talk to about whatever I want to talk about. Mainly, it's not just about healthcare. I've had all kinds of specialties and influencers in and around Northwest Florida on. I've had a couple of people that have had, New York Times bestsellers on, remotely come in, type thing. So I discuss anything current, a lot of legislators on there, just because that's what I love to do is talk to senators and representatives. So it's, I talk to veterans, and so it's just fun. Anybody I find that I want to talk to, I grab them and bring them on the show and chat with them for about 30 minutes or so.
Hey, look, preaching to the choir here. I started Meet the Experts as kind of just like, hey, how do I grow my network and give somebody some value in advance and give people video content that they otherwise wouldn't get on their own? And I talk to pretty much who I want to when I want to. And
well, I'm glad you found me, because this was amazing. I love the podcast. I love it.
I love that. Thank you. Speaking of, all right, this is where we're going to slow it down. I've only had 4 people cry ever when they're answering this question, so no pressure. I've done 56 episodes. I'm just saying, what, Monica, tell us something that you're truly thankful for.
I'm an easy crier.
Uh-oh.
I know. No, I am thankful for, of course, the healthcare advances that have kept my son with me. Yeah. Healthy, have a healthy daughter. My husband did 33 years in the Marine Corps, and he came home healthy. He's deployed quite a few times. So just a family, happiness, healthy, and me being able to go to, great institutions for education and for learning cardiovascular care. That is huge, because now the thing I am most grateful for professionally is, like I said, being able to go out to communities and help other people stay healthy when they literally just don't know. And we teach them that, we educate them in awareness, and then advocate for those that, I'm their voice. So they don't have a voice, or not everybody wants to go to state legislators. And so I'm very grateful that I can do that, and I do that, and I'm in a position to.
I'm so glad you said all that. And it is, and it's such good. I mean, it's such admirable work what you do. And I'm a big believer that we need to be thanking our frontline people. My wife is an ultrasound tech. She's very frontline with doing things. Yep. And so I'm always in awe of what she does. I'm in awe of what you do. And I just think it's amazing. I've got one more question that I want to ask, and I don't know how strongly this is going to apply to you. Oftentimes it's more for just that business question. Right. But you mentioned something earlier about what's my blood pressure? What's a normal blood pressure? What's this? What's that? What are some things that you get asked all the time in your line of work? And maybe how do you answer them?
How to control a blood pressure. That's probably the number one thing, because a lot of people don't know. And one of the physician I mentioned that helped write this grant, she is certified she's Harvard certified in lifestyle wellness using culinary medicine, mainly teaching how to cook healthy. Wow. So, we work together to tell people what's a good protein, what's a good carb, a bad carb, a good, things like that. Because that is probably the number one thing is my blood pressure. I don't want to take a bunch more medicine. How do I control my blood pressure and weight, things like that? Just normal stuff that most people do not know how to manage.
So do you think, sorry, there's just a spin-off question. Do you think that just a little bit like walking, just a little bit of exercise and a good diet is just really critical and can really go a long way?
100%. Literally, there have been many studies from American Heart Association, American College of Cardiology that show even a 6-minute walk test. That's what we put some of our patients under if they're in any kind of, heart failure spectrum or things like that, what we call stages. But we make sure that they can walk 6 minutes. Walk 6 minutes. And because if we tell somebody to go out and exercise 30 minutes or an hour or do things, it's overwhelming. Yeah. And a lot of patients that are overweight or have diabetes, high blood pressure, it's hard for them to walk even 10 minutes, Sure. So I tell them to start at, 3 to 6 minutes and just build up either slower or longer length. And it's actually, there have been studies on it that 3 to 5 minutes, 3 to 5 times a week, have proven over 3 to 6 months to decrease blood sugars, blood pressure, stopping people from smoking, things like that. So even if you can get out and just move for 6 minutes, we would love it. And I wrote prescriptions for that, walking And
that.
and we can write prescriptions now. Some areas prescriptions for to go and purchase a healthy diet. It's covered. It's prescription, so they can pick up healthy food.
That's amazing. I didn't know that. I want that. So
definitely makes 100% difference. So
lean turkey salad and a walk with the dog every day. And that's
definitely.
it. That'll be good. All right. So if you want to learn more about Monica, check her out on Facebook, Monica Sanford Show. Go check out the podcast. If you're ever in Florida, just know that she's making a big impact down there with legislators. And Monica, thank you so much for being on the show. I can't wait to talk to you again. And now I know where to go if I have a question about some cardiovascular health.
Definitely. Thank you for having me on. It was a pleasure.
Absolutely. Talk to you soon. That was great. Monica was a joy to talk to. Very, very fun and eye-opening stuff. But I know, like, look, just those little walks. I mean, I got a Samsung watch and I'm challenging my best friend. We're going to try to do a weekly challenge of 60,000 steps a week. If one person hits it and the other one doesn't, it's a $10 wager on the line every week. So hey, look, you tell me I got a $10 bet on the line. I'm ready to swim across the ocean to win it. So, anyway, that was a really good episode. And I told you at the beginning, if you want to be a future guest on Meet the Experts, just look at the ticker down at the bottom now, which I will get that right someday. It's only 50-something episodes in. Go to www.meettheexpertspodcast.com, www.meettheexpertspodcast.com. Costs you nothing to be a guest. We will interview you just like we did with Monica. We'll give you the full video. You can do whatever you want with it. Upload it to Spotify, put it on your website, chop it up into little clips and run it out on all your social media channels. It's yours to keep. It's yours to do whatever you want. So no excuses. If you're like, I don't know how to create videos, right? Just come on the show. I'll give you a video all about you, your business, your products, your services, what you do, your specialty. And if you want, we can also help you with the production of it and the promotion of it afterwards, if you so choose. But we've got like 10 more episodes that we're going to be recording soon. So if you're watching this, just know there are a bunch more episodes in the queue to come out. And we can't wait to see you on a future Meet the Experts.